Acadian Beharie, acting corporal attached to the Jamaica Fire Brigade Station at the Southern Fire Station, and today I am going to be doing a demonstration of the checks performed on our ambulance unit as well as the patient cabin. Now I am going to be starting from the room here. So immediately in my hand we have the brake fluid. Now we want to ensure that there is enough brake fluid in this container, and to help us in determining that, there is a max and a minimum line or indicator on the container. Now if it is at the minimum line, we will know that it needs to be replenished. However, if it's at the maximum line, then we know that it has enough brake fluid in it. To this section we have the radiator fluid. Now in this container you want to ensure that there is enough radiator fluid inside the container to service the radiator. To this section we have the windshield wash, and it is used to clear debris from the windscreen and ensure that the driver has proper visuals while driving the vehicle. We are now going to be moving into the driver's cabin, where I am going to demonstrate some further checks. Continuing from the driver's cabin, we are now going to be checking the power steering fluid. Now the power steering fluid, because on the container it also has a max and a minimum line indicator. However, we can pull it, and once we have pulled it, you can see that it's dripping to indicate that yes, there is power steering fluid inside the container. As I said, there is a max and a minimum, so you can also do a visual check to ensure whether it needs to be replenished or if it has enough fluid inside the container. Over this section we have a dipstick for the engine oil. Now we remove the dipstick from the compartment, and after we have removed the dipstick from the compartment, we will use a clean cloth to wipe the fluid from the stick, which we will then reinsert into the compartment and remove once again to measure the amount of engine oil that is in the compartment by seeing where along the stick the engine oil is. I am now going to place the dipstick into the compartment. Also, we will check the battery terminals. We want to ensure that they are not loose nor corroded for proper functionality. While I am standing at the wheel, right here I have the gauge. I am going to proceed to check in the PSI of the tires and to ensure that it is at 40 PSI. All 4 tires must be at 40 PSI. Now in order to do this check, I am going to put this end of the device right here and check to see that it's at 40 PSI. It is at 40 PSI. Now I am going to continue over into the driver's seat to do additional checks. Now that I am in the driver's seat, I am going to proceed to check in the seat belt. You want to ensure that it is releasing properly, and I am going to put it back into its position. Now in this section right here we have the PA system. I am going to proceed to turn in on the PA system because the PA system is also responsible for the siren or the siren flash, sirens and the siren flash. So I am just going to go ahead and test these to ensure that they are all functional. First with the siren flash and then with the sirens. I am going to power off the system, and that would have concluded the checks for the siren flash and the sirens. I am also going to proceed to check in the horn on the steering. I am also going to check the wipers to ensure that they're functional. I am going to check my indicator lights to see that they're also functional, as well as my headlights. Proceeding with my checks, I am going to ensure that my speedometer is functional, and I am going to also check the fuel tank, and as it is currently reading, it is at full. So all these checks are necessary for a driver to operate at the maximum potential when responding on the road. I am now going to move into the patient's cabin. Now that we are in the section of the ambulance where we transport our patients, we are also going to be checking our equipment. Here with me I have a checklist to ensure that I have all the necessary equipment available to me to provide the best care necessary to my patients. This checklist, I should mention, is also used to check the driver's section, which includes the engine room as well as the PA system, fuel gauge, and so forth. Now, right in front of me, I have my jump kit. I will check my jump kit to ensure that all the necessary equipment are in there, as I said, to provide best patient care possible. To this section, we have our vital devices. These would be ticked off on the check sheet as I go along. Now proceeding to other equipment that are on the unit, right here we have our onboard oxygen cylinder. You want to ensure that there is adequate amount of oxygen in the cylinder to provide care for our patients. To this section, we also have a portable oxygen cylinder, which you also will check for oxygen in order to care for our patients. In this corner here, we have an AED. We would turn this on to ensure that it's given the necessary instructions and to also ensure that it is functional. Right here, we have our fire extinguisher, which, as you know, is a necessity on our emergency unit. In this section, we have our suction unit, and in these cabinets below here, we have our OB kits, we have a BVM, we have non-rebreather masks for both adults and pediatrics, as well as nasal cannulas. Our checklist will ensure that we have adequate amount of each of these items in order to provide for our patients. As we move along, to this section we have our C covers. We usually have different sizes to provide for different patients. We have our stretcher, we have our scoop backboard, and we also have a clock on here, which is actually very useful when taking times when we're doing our vitals. Since we're at the back of our unit, I must make mention that our checks would reveal that we have a spare tire right below this section of the unit. Now I am going to go into demonstrating how we will remove the stretcher from the ambulance, load the patient onto the stretcher, put the patient into the ambulance, and then remove the patient on the stretcher from the ambulance.
Don't squeeze.
Alright, I'm going to move into loading a patient on the ambulance. At this time, I am going to enlist the assistance of one of my co-workers. Lowering on 3. 1, 2, 3. Want to ensure that the patient is secured to the stretcher by using the straps. Cool.
One, Angie, 1, 2.
Alright, now that I have loaded the patient into the ambulance, I am going to say that we are now at the facility and I am going to proceed to removing the patient from the ambulance. Alright, and that would conclude my demonstration. Thank you.